we will cover the bones, ligaments, injuries, and assessments that go with those.
If there is an injury to this site, like any other area, we have to go through the HOPS process. You should ask questions about the present history to determine the severity of the injury. Examples of those questions are like, what and how did this happen? What movement were you performing when the injury occurred? Did anything bend or move in a certain way? Are you in any pain? If so, rate it on a scale between 1 and 10.
You should also ask, does the pain or sensations radiate or move anywhere? Is the pain sharp, dull, or burning? Have the athlete give the pain a quality. Can you pinpoint the exact place of your pain? Did you feel or hear any pops, snaps, or cracks, or any other weird sensations or sounds? Are you having difficulty breathing? Do you feel cold, or do you feel nauseous?
Doubt about their past history, you should ask, have you ever injured this part of your body before? If yes, how long ago was the injury? How was the previous injury treated, rehabilitated, etc.? Do you have any serious medical conditions I need to know about? Are you taking any prescribed medications? Do you have any food or drug allergies?
Use visual clues to help determine what may be wrong with the patient. Look for deformities such as changes in symmetry, discoloration such as redness, bruising, or blue tint. You may also notice that the athlete is walking with the limp or may be showing facial expressions that show they are in pain.
Is to touch. You may need to palpate the athlete to further inspect the injury. Check the athlete's skin to see if it feels warm, hot, or cold. Check to see if you can feel any palpable gaps, defects, or deformities at the injury site.
When we're evaluating a patient, we must check the most prominent bony landmarks to make sure there are no deformities to it. First, you want to look at the ASIS, which stands for Anterior Superior Iliac Spine, to the PSIS, which is the Posterior Superior Iliac Spine. And from the ASIS to the PSIS is the iliac crest. Then as you move further down, there's the pubic bone and the pubic symphysis there. Then it leads into the iliac crest and the sacrum over here. And then an attachment point to the hip, to the thigh, is the greater trochanter out here on the lateral side of the hip, and then the lesser trochanter is on the medial side.
Once we have palpated, we check to see if there's a more serious injury by checking their circulation. We do this by blanching the nail beds on the toes to ensure the blood supply is still flowing past the injury site. We also check the distal pulses on the neck, wrist, and foot. Right back to Fred.
Ask if there are any unusual feelings, sensations when palpating the injury site. Crepitus, or a clicking grinding noise, is often heard or felt after an injury. See if the injury site is tender to the touch. You may also need to perform special tests. Special tests are tests that help us determine how severe the injury is to specific structures. The results of these tests can give us an idea as to the severity of the injury. Tests can be used to test for joint or ligamentous laxity, joint ROM, active, passive, resistive, muscle strength, function, and neurological deficits. The special tests for the hip, thigh, and pelvis include supine to long sit test, TEGS test for federal anteversion, retroversion, Gaines lens test, 90-90 straight leg raising test. Now we will go over the hip movements and what muscles are responsible for what movements. The gluteus maximus extends the hip, while the gluteus medius and minimus are involved in hip rotation and abduction. The adductor group, which includes adductor brevis, longus, and magnus, along the peteneus and gracilis, move the femur towards the midline of an abducted position. The iliopsoas group is the iliacus and the psoas major, which is responsible for hip flexion. Now we will demonstrate some special tests. We'll start with Fulcrum's test. The athlete will start seated with her knees bent at the end of the table. I will place my forearm underneath the athlete's mid-thigh and use my other hand to push down on her thigh. A positive test, if the test is positive, she will experience pain. After that, we will do the Galen's test. A positive test would also result in pain.
No pain.